So, hello classmates and hello ma'am. I am Queenie Havana from BSM first year. So, this is my report about sexually transmitted diseases or STDs. So, sexually transmitted diseases or STDs are sexually transmitted infection STIs are generally acquired by sexual contact. The bacteria, viruses, or parasites that cause sexually transmitted diseases may pass from person to person in blood, semen, or vaginal and other bodily fluids. So, sometimes these infections can be transmitted non-sexually, just as from mothers to their infants during pregnancy or childbirth, or through blood transfusions or shared needles. STIs don't always cause symptoms. It's possible to contract sexually transmitted infection from people who seem perfectly healthy and may not even know they have an infection. So here is a symptoms of STDs or STIs. Can have a range of signs and symptoms, including no symptoms. That's why they may go unnoticed until complications occur or a partner is diagnosed. Signs and symptoms that might indicate an STI include, so here is sores or bumps on the genitals or the oral or rectal area, painful or burning or urination, discharge from the penis, unusual or odorous vaginal discharge, unusual vaginal bleeding, pain during sex, sore swollen lymph nodes, particularly in the groin, but sometimes more widespread, lower abdominal pain, fever, rash over the trunk, hands or feet. So, signs and symptoms may appear a few days after exposure. However, it may take years before you have any noticeable problems, depending on the organism causing the STI. When to see a doctor immediately if you are sexually active and may have been exposed to an STI. You have signs and symptoms of an STI. Make an appointment with a doctor when you're considering becoming sexually active or when you are 21, whichever comes first, before you start having sex with a new partner. So, here is a causes of STDs or STIs can be causes by bacteria, gonorrhea, syphilis, and chlamydia are examples of STIs that are caused by bacteria. Parasites, trichomoniasis is an STI caused by the parasite. Viruses, STIs caused by viruses include HPV, genital herpes, and HIV. Other kinds of infection, hepatitis A, B, and C. Viruses, Shigella infection and Giardia infection can be spread through sexual activity, but it's possible to be infected without sexual contact. Then the risk factors. Anyone who is sexually active risks some degree of exposure to an STD or STI. Factors that may cause increase that risk include having unprotected sex, vaginal or anal penetration by an affected partner who isn't wearing a latex condom significantly increases the risk of getting an STI. Improper or inconsistent use of condoms can also increase risk. Oral sex may be less risky, but infection can still be transmitted without a latex condom or a dental dam. A thin square piece of rubber made with latex or silicone. Having sexual contact with multiple partners, the more people you have sexual contact with, the greater your risk. Having a history of STIs, having one STI makes it much easier for another STI to take hold. Being forced to engage in sexual activity, dealing with rape or assault is difficult, but it's important to see a doctor as soon as possible to receive screening, treatment, and emotional support. Misuse of alcohol or use of recreational drugs. Substance misuse can inhibit your judgment, making you more willing to participate in risky behaviors. Injecting drugs. Needle sharing spreads many serious infections including HIV, hepatitis B, and hepatitis C. Being young, half the new STIs occur in the people between the age of 15 and 24. Transmission from mothers to infant. Certain STIs, such as gonorrhea, chlamydia, HIV, and syphilis, can be passed from mothers to their infants during pregnancy or delivery. STIs in infants can cause serious problems or even death. All pregnant women should be screened for this infection and treated. So, here is a complications. Because many people in the early stage of STD or STI experience no symptoms, screening for STIs is important to prevent complications. This is the possible complications include, here they are: pelvic pain, pregnancy complications, eye inflammation, arthritis, pelvic inflammatory disease, infertility, heart disease, certain cancers such as HPV associated cervical and rectal cancers. And also, here is a prevention. There are several ways to avoid or reduce your risk or STDs or STIs. Abstain. The most effective way to avoid STIs is not to abstain from sex. Stay with one uninfected partner. Another reliable way of avoiding STIs is to stay in a long-term relationship in which both people have sex only with each other and neither partner is infected. With and test. Avoid vaginal and anal intercourse with new partner until you have both been tested for STIs. Oral sex less risky, but use a latex condom or dental dam to prevent skin-to-skin contact between the oral genital mucous membranes. Get vaccinated. Getting vaccinated early or before sexual exposure is also effective in preventing certain types of STIs. Vaccines are available to prevent human papillomavirus, HPV, hepatitis A, and hepatitis B. The Centers for Disease Control and Prevention (STDs) recommends that HPV vaccine for girls and boys age 11 and 12, although it can be given as early as age of 9. If not fully vaccinated at age 11 and 12, the CDC recommends getting the vaccine through age 26. The hepatitis B vaccine is usually given to newborns, and hepatitis E vaccine is recommended for a 1-year-old. Both vaccines are recommended for people who aren't already immune to this disease and for those who are at increased risk of infection, such as men who have sex with men and IV drug users. Use condoms and dental dams consistently and correctly. Use a new latex condom or dental dam for H6 Act. Whether oral, vaginal, or anal, never use an oil-based lubricant such as petroleum jelly with a latex condom or dental dam. Condoms made from natural membranes are not recommended because they are not effective at preventing STIs. Also, keep in mind that while latex condoms reduce your risk of exposure to most STIs, so they have less protection for STIs involving exposed genital sores such as SPV or herpes.